Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's April 10th, and yesterday I spent an incredibly inspiring day in Sacramento, California, with MS activists from all over the state, as we engaged our state legislators in conversations about pending legislation that will impact people living with MS in California. You know, just last month I had the opportunity to go to Washington, D.C. and speak with members of Congress about national legislative issues that are important to people living with multiple sclerosis. And it was just so inspiring to be with really amazing MS activists like Jody Cooley, Tamara Williams, Patty Barker, Dan and Jennifer Digman. I mean, no matter where I looked or where I went, I felt like I was constantly surrounded by so many awesome and energized people. And yesterday, I got to do it again on a state level. Dion Herrera, Donia Baines, and I made our way to about a half dozen state assembly and Senate offices to talk about how important it is to have access to quality, affordable health care, and why we need to provide full disability access in public restrooms, and why we need to ensure that people living with MS have access to affordable prescription medications. We had some great conversations, as did so many of the other teams of MS activists who descended upon our state capitol for the National MS Society's State Action Day in California. And if you aren't yet advocating on behalf of your own self-interest, I'm going to remind you once again how empowering it is and invite you to get involved as an MS activist. You can visit the National MS Society's website, click on Get Involved, and you'll learn all about advocating for change. You know, one of the things that I try to do on the podcast is introduce you to all sorts of MS warriors. In previous podcast episodes, we've talked to leading neuroscientists who are doing cutting-edge MS research. We've talked to activists who are representing the needs of the MS community and influencing public policy. We've talked to people who exemplify what it means to live your best life with MS. And today, my guest is another type of MS warrior. He's a fundraising warrior. My guest on today's podcast is Jace Riley. And Jace is honoring the memory of his late mother by riding his bike 3,785 miles across the United States to raise money for MS research. We'll talk to Jace in just a moment, but first, there are a few other things that you should know about. In a study published in the Journal of Neurology, Neurosurgery, and Psychiatry, researchers have demonstrated that an online therapy program called Ele Vita, or it might be Ele Vita, I'll let you decide, but the program is effective in reducing fatigue in patients with multiple sclerosis. The study involved 275 patients with MS and fatigue who were recruited through the MS Society in Germany. The study participants were placed into one of two groups. One group received standard typical care, and the other group used the Ele Vita application at home for 12 weeks. Now, the patients in the group that used the Ele Vita therapy at home showed a significant reduction in fatigue. In fact, they demonstrated reduced motor fatigue, reduced cognitive fatigue, and reduced anxiety. And these benefits, they sustained themselves throughout a 24-week follow-up to the study. Ele Vita therapy was seen to improve the quality of life for these patients, and it provided them with a greater ability to handle fatigue compared to patients who were reliant on medications to manage their fatigue. The Ele Vita software provides a guided therapy session where each patient moves through the session at their own pace, reading specific content and answering multiple choice questions, and each patient's individual progress is tailored to the answers given to these questions during the session so that progress is matched to each patient's needs. Patients are advised to use the Ele Vita program just once or twice a week. Now, the software itself was developed by a multidisciplinary team that included physicians, psychologists, psychotherapists, and IT experts, and it's based on cognitive behavioral therapy and psychotherapeutic approaches like mindfulness. We know that advances in technology enable greater scientific discovery. And sometimes we tend to think of those advances in technology in the abstract, something that happens in Silicon Valley. But I think that this is just the tip of the iceberg for people living with MS and many, many other chronic illnesses. We're going to be hearing a lot about smartphone apps, desktop programs, and wearable tech devices that are all being designed to help better manage MS symptoms, better track patient activity, or communicate a more detailed, complete, and reliable picture of a patient to their doctor, so that their doctor is in a position to better fine-tune their patient's treatment options. And in some cases, that doctor receiving all of that patient data will one day be a bot that's been programmed with artificial intelligence. This is just the very beginning, but it's already an amazing start. Fatigue is one of the most common symptoms of MS. According to the National MS Society, about 80% of the people living with MS are dealing with MS-related fatigue, and the terrible truth about fatigue is that it gets in the way of your ability to function at home and at work. As a matter of fact, fatigue is one of the primary causes of someone with MS deciding that they have to stop working, and that single decision, well, that creates a bunch of new problems and situations to deal with. And I think that the fact that the thing that is being shown to give people with MS significant help in managing fatigue isn't a drug or another medical specialist that you have to make time to see, but an application that you can access from your own home at your own convenience. That's truly remarkable. The LG 300 Go system is a high-tech rehab device that's been designed to help MS patients who are dealing with foot drop or knee and ankle flexing when they walk. The device is a sort of high-tech knee brace that uses data from a 3-axis gyroscope and accelerometer to generate 3D detection of changes in a person's gait within 10 milliseconds. That's 30 times faster than the blink of an eye. Now, the device then applies mild electrical stimulation to the patient's muscles to tweak their performance and even out the patient's gait. Now, the LG 300 Go system isn't brand new, but what is new is that the FDA just approved a mobile app for use with the LG 300 Go system. The app is called My Bionis, and it gives the user the ability to control the system with pinpoint accuracy. They can change between calibrating the LG 300 Go system for gait or for rehab training. They can even set the level of electrical stimulation that the device produces to predetermined intensities depending upon their rehab needs at that moment. The app will also allow users to track their activity, set walking goals, rehab goals, and see their progress over time. The My Bionis app will be released shortly for iPhones, and we'll hopefully be seeing an Android version very soon. Speaking of smartphones, the University of Southern California is recruiting volunteers to test drive My MS, a smartphone app designed for people living with multiple sclerosis. The app will ask you to complete 6-minute walking tests, cognitive function tests, vision tests, and quality of life surveys. The app will also ask you to upload your MRI scans, and after using the app for 3 months, participants will be eligible to receive a free genetic analysis from 23andme.com. All of the information that you enter into the app will be available to you so that you can begin to see symptom trends over time, and your neurologist can begin to fine-tune and personalize your MS treatment and symptom management options. Participants in the study must be 18 years old or older. They must be diagnosed with multiple sclerosis. They must have a smartphone, and they must understand English. There are no clinic visits required for this study, and to get started, just visit mspilot.usc.edu, and we'll be sure to include a link to the registration website in our show notes. And while we're talking about some of the ways that technology is changing the way that healthcare is being delivered, it's also a good time to point out that there are already generational differences in how people prefer to engage with their healthcare providers. The 2017 Employee Benefit Research Institute and Greenwald & Associates Consumer Engagement in Healthcare Survey contacted over 3,500 adults who had health insurance, either through an employer or through an individual marketplace policy, and the survey results show that 85% of all baby boomers have a primary care physician. But that compares with 78% of Generation Xers and just 67% of all millennials. And where people choose to get healthcare services is also a generational issue. Only 14% of the baby boomers have used a walk-in clinic, compared with 30% of the millennials. And while we're talking about where people choose to get their health care, sometimes there's no place like home. Telemedicine was rated as, quote, an extremely or very important, end quote, option to 40% of millennials, compared with just 19% of the baby boomers. And since there are an estimated 75 million millennials, these new perspectives on who is going to treat you and where you're going to receive treatment, well, those perspectives on the part of healthcare consumers become incredibly important as healthcare providers decide how and where they want to meet their patients now and in the future. And for people of any generation who may be living with a disability, telemedicine and applications that can be accessed from home can provide an important and sometimes necessary level of convenience that makes it easier and more feasible to seek treatment and communicate with your healthcare team. Living with multiple sclerosis can sometimes feel like you're locked into a lonely battle against a disease that can morph itself into almost any number of symptoms at almost any time. But you don't have to fight your battle with MS by yourself. There are amazing resources literally at your fingertips. Last week's guest on the podcast, Stephanie Buxhoveden, mentioned 2 places to turn to online. One is extremely well established, and the other is pretty new. Stephanie suggested spending time at the National MS Society's website, and she also mentioned a relatively new online resource that she had a hand in developing, along with an organization called Can Do MS, the Society for Participatory Medicine, and the pharmaceutical manufacturer Sanofi Genzyme, the maker of 2 MS medications, Aubagio and Limtrada. This new free online MS resource is called MS Path to Care, and it's designed to empower people living with MS to become more active participants in their own healthcare. MS Path to Care offers 4 video modules that will teach you about the importance of putting together your healthcare team, how to be a good partner in working with your healthcare team to manage your MS, strengthening your support partnership, and how to go about navigating the healthcare resources that will help you better manage the other areas of your life that will be affected by MS, like your finances, your job, and your relationships. They say that in life you can't have too many friends, and I like to tell people that in living with MS or any chronic illness, you can't have too many online resources. It's always great when we can turn to someone for reassurance or for answers or to simply better educate ourselves about MS, but sometimes our worries creep into our consciousness late at night, or a question pops into our head at a weird hour of the wrong day, and it's just not the time to turn to someone. And that's when you want to remember that the internet never closes. It gives you access to some wonderful resources 24 hours a day, 7 days a week. You just have to know where to look. So be sure to add MS Path to Care, and that's MS PATH, the number 2, care.com, to the list of online MS resources that I hope you're already keeping. I'll include links in the podcast show notes to MS Path to Care, the National MS Society, and all of the other online applications and organizations and companies that we've talked about today, so be sure to look for the show notes. And in a moment, we'll meet my guest this week, Jace Riley, an MS road warrior who's about to ride his bike 3,785 miles across the United States in honor of his mom to raise money for MS research. There are all kinds of MS warriors, and today we're going to be talking to an MS road warrior. My guest on the podcast is Jace Riley, and this summer, Jace is going to ride his bike 3,785 miles from one end of the United States to the other to raise money and awareness for multiple sclerosis. Welcome to the podcast, Jace.
Hi. Glad you had me on here.
Let me ask you, how did you come up with a plan to ride across the country for MS?
So my cousin actually, she's done it before through the organization called Bike the US for MS. And whenever she did it, I knew I was probably going to end up doing it at some point. And this summer, all my everything basically aligned for me. So now I'm going to do it this summer.
What made this a cause for, I guess, both your cousin and for you? Why MS?
So my mom had MS, actually. She had it for 13 years until she lost her battle with it, passing away in 2014. Basically 2 weeks before my senior year of high school started. And my cousin did a few MS rides up in, I believe it was Columbus or Cleveland, Ohio. They were 80-mile rides benefiting MS. And she liked it a lot. So then she ended up looking up something else, and that brought her to Bike the US for MS. And whenever she did it, like I said, I knew I was going to do it. So that's kind of our inspiration, was my mom passing away. That would be her aunt.
Of course, sorry to hear about your mom. You know, I always like to remind people that MS really affects families, not just individuals. So let me ask you, how did growing up with your mom as she was dealing with MS, how did that affect you?
It was pretty hard, really. It affected me every day of my life. Whenever I was little, she could obviously walk a little bit. And then as it progressed into my teenage years, she began to become wheelchair bound or walkers. And then the last 2 or 3 years of her life, it was nothing but wheelchair or automated wheelchair, or basically just us carrying her. And that was really hard. It was really hard on myself, my father, the rest of my family that would come and visit. Extremely hard. But it affected me. It basically made me who I am today. I have a lot of respect for anyone who has a disability like that, whether it be terminal like hers or some other kind of mental disability. And so it basically gives you a lot of insight into what these people deal with, and it makes you very grateful. I'm very grateful for the life I live right now, to not be wheelchair bound or to have cancer or anything like that. So very grateful.
I couldn't agree more, and I totally get it. Unfortunately, my experience is also with someone in my family who developed MS. And I think that when you grow up in that sort of a situation, no matter what your age, you come to realize pretty quickly that good health is not automatic. It's not a guarantee. And I think you come to appreciate that sort of thing real quickly.
Yes, sir.
Getting back to your upcoming ride a little bit, I understand that you're not like a lifelong avid cyclist. How much cycling experience do you have?
I had a bike when I was 10, so that's pretty much it. In terms of road biking or mountain biking or any of that crazy kind of biking, none actually. I just got a bike this Sunday, and I rode it probably a mile so far.
So does that make you at all nervous?
Yeah, it does actually. It makes me really nervous, especially just trying to learn the components of the bike. I had a friend help me out last night getting pedals and filling up my air, changing a few things around, cleaning my chain. All these things, I have no idea how to do. So it was definitely good that he helped me out a lot. He showed me a lot of the tricks, everything like that. So, yeah, I was a little nervous going into last night. Like, oh, my gosh, I'm just now realizing I don't know a thing about this bike besides it having two wheels and a chain. But, yeah, I'm nervous, yep.
Yeah, I have a feeling you're going to learn all about that bike in the very near future.
I'm going to learn every detail, every inch, every centimeter of this bike by the time the trip starts. That's for sure.
So when does the trip start? When does it start? Where does it start from? And where do you end up?
So it's going to start in Yorktown, Virginia on June 1st, and I'm going to end in San Francisco, California on August 1st.
Wow, that is truly coast to coast. How far are you going to travel every day?
So it varies. Some days we go 48 miles. That would be in Colorado, so you have to deal with the hills. Most days we're going to travel about 70 to 80 miles. And in Kansas, we'll actually have 2 or 3 100-mile days. So it really just depends on our location as to how far we'll be biking each day.
You've mentioned that you're doing this kind of under the auspices of or as part of a team from Bike the U.S. for MS. Can you tell me a little bit about what that organization's all about?
So, yeah, the organization was founded, I believe, in 2007 from a guy whose mom actually had MS. And him and 3 friends basically biked across the U.S. that year. And then they decided that, this was awesome. So the founder basically just did a lot of fundraising, did a lot of research, and then he brought his idea to a few different people, and then they wanted to do it. And then now it's branched out into this organization that has, I believe, 100 or so riders each year doing bike trips across America from coast to coast or from like Maine to Florida, if you want to do like the coastlines like that. They raise a lot of money so far to this date. I believe we've raised over $100,000 just in this year alone. So this first 2 months, it's been $100,000 for MS research, and it's just incredible. And I believe the last few years they've raised, hundreds of thousands, if not millions of dollars in 10 years or so.
Now, I know your fundraising goal. I peeked on the page on the website. I saw your goal is $3,785. And while I'm not a real math whiz, I think that works out to $1 a mile that you're going to be traveling. Let me ask you, how can people listening to us on the podcast help sponsor your ride? What can they do?
They can go to biketheusforms.org, and then you can go to the cyclist tab, then the Trans Am route, and then find my name on there, Jace Riley. And then you're able to donate straight on the website, and all that money will go to help me meet my goal and to help fund MS research.
Well, Jace, on behalf of so many people who are dealing with the same kinds of things that your mom had to deal with as she battled MS, and all of their sons and daughters who were dealing with the same kinds of things that you had to deal with, thanks for your commitment to raising funds and raising awareness of MS, and thanks for being with us on the podcast today.
Yeah, thank you very much, sir. I appreciate it.
And that's going to wrap up this installment of the Real Talk MS podcast. I always appreciate getting your feedback, your comments about the podcast, and your suggestions about the kinds of things you'd like to see us talk about. So please go ahead and send your email to me at John, that's Jon, at realtalkms.com. And if I can ask for a favor, when you have a moment, I'd love for you to submit a rating and a review of the podcast. I've made it easy for you to do that. Just visit realtalkms.com/rating, RATING, and you'll automatically be connected with the iTunes page for you to submit that rating. That would mean a lot. My name is John Strum. Thanks again for listening, and we'll catch you next time.